Assessment. The nursing process is a critical thinking process, or could be described as a blueprint for providing client care. It consists of 5 steps: assessment, diagnosis, planning, implementation, and evaluation. It's also a standard of practice that would help provide legal protection should that need ever arise. The nursing process is dynamic and continuous. Assessment is a deliberate and systematic collection of information that looks for current and past information, history, functional status, and coping patterns. There are several steps that are involved, actually just 2 steps involved. Collection of information from primary and secondary sources, with the primary source being the client, and the primary source or the client is usually the most reliable of the sources. The secondary source is family, friends, medical records, or maybe even other healthcare team members. The second step is interpretation and validation of data. You have to confirm that the data you've collected is correct. All of this information is used to establish a database. It involves critical thinking and prior experience to help determine the extent of the assessment. The assessment is the initial step in determining client care. If you do have a client status change, you have to remember to always assess or reassess. And make sure that you perform your own assessment. Never rely on someone else's assessment. Data collection will come from the patient, which could be through the interview, through observations, or an examination. Information can come from family or significant other through their reports. Can come from other healthcare team members. The medical record can provide test and procedure results, patient history, consult information. And scientific literature can provide evidence that regards techniques and standards. Your assessment will begin as soon as you see the client. How does that client look? How does the client act? What does the client say? How is the client moving? All of this can help you focus your assessment. It is of vital importance that you develop a routine for your assessment. It will help you decrease omissions. Most people will start head to toe and work through everything in between. But whatever you start with, make sure that you develop your own routine. Look for cues. Cues are information that's obtained through the senses. In other words, again, how is the patient acting, looking, talking, walking, etc. Inference is judgment or interpretation of the cues. Subjective data is what the client says, and objective data is what is observed or measured. And again, the client is going to be your best source of information. So again, how do we collect data? Excuse me. We start off with patient-centered interviews. Review the available information prior to the interview because it will help direct your assessment focus. If you have it available, look at the patient record or the medical record, patient report or the medical record. Make sure that you limit distractions. Observe the client for cues as you're interviewing. The client will direct who is in the room for the interview. I would normally go ask my client, I'm getting ready to ask you a lot of questions and I'm going to do your physical assessment. Do you want so-and-so to stay in the room, or would you like them to step out while we do this? The client may be more open in revealing information if people step out of the room. So the steps for this patient-centered interview would be to set the stage. This is also called orientation. This is where you will introduce yourself and explain why you're there. Make sure, again, that you provide privacy. Then you begin gathering information about the client. You collect data by using open-ended questions, using therapeutic communication techniques, encouraging the client to open up and provide details of the concerns or problems that have brought them into the hospital or the doctor's office or wherever it is they're at. And then terminating the interview. Advise the client when the interview will be complete. I just have a couple more questions and then we'll be done, and I'll move on to my physical assessment. Advise the client what to expect when you're leaving and when you will be returning to provide any care. The interview is designed to discover information. Now, nonverbal communication can really provide a lot of significant information. Observations can then direct your interview. For example, you're interviewing a client and they're continually grimacing, or you're interviewing a client and they're continually holding their stomach. This can lead you to believe that the client is in pain. The second one, the client is more specifically having abdominal pain. So that would help you focus your assessment. Appropriate techniques can help build trust in the nurse-patient relationship. Open-ended questions are part of therapeutic communication, and they prompt the client to use more than 1 to 2 words in a response. Back channeling is the use of listening responses such as go ahead, go on, etc. Probing is where you're encouraging more information from the client, such as, is there anything else you can tell me? Close-ended questions will be requiring those short answers, and they can help clarify information. Always be aware of potential cultural issues. For example, eye contact may be considered rude. Touches may not be allowed between genders. The manner of addressing a person can be significant. And make sure that you avoid stereotyping. The health history is information that will ultimately become part of the medical record. This information can provide clues to another problem that the client is not really presenting with. So again, methods of data collection will include physical examination, which will involve inspection, palpation, percussion, auscultation, and smell. Observation of client behavior. Is what you're seeing matching what you're being told? Diagnostic and lab data. Interpretation and validation of data. Again, is the data that you're receiving correct? And is the data you're receiving complete? Timeliness and thoroughness and accuracy is required. Again, concept mapping can help you see the overall picture.